to us, it's very clear that we need to have much more patient engagement. I mentioned during the panel discussion that companies like ours, historically, we've really interfaced with physicians mostly. We've done that for 100 years. We've refined it in some ways. We've perfected it. But that comes from an era in which everything went exclusively through the physician. The physician was the learned intermediary. Patients got all their information from physicians. That's not the case now. And we want to get patient input on benefit risk, for instance. We want them engaged in various discrete points along the way in this complex process of making a drug. But I think it's important to realize that the best patient for us is an informed patient. So it's not just getting input from people, but for those who are interested enough, patients who come to understand what's involved in inventing a drug, what's involved in the oversight of the regulatory agencies, what's involved in decisions about whether an insurance company is going to pay for it or not. Their understanding of how that's done is most helpful to us when they then have to get us input about actually having the disease, living with the disease, or being a family member helping to take care of somebody with the disease. I can report happily that the people in the company really are interested in serving patients. That's why they're there, from the person who drives the shuttle bus all the way to the finance people, all the way to the researchers. But they've got practices that they've been using for a long time, which we need to change. And this interface with the patient's been distributed. So in our company, we've taken my office, the office of the chief medical officer, and we've said, you know, we're going to try to coordinate for this large company the interface with patients and patients' organizations. And we'll try to be the kind of point person to steer the input to the right places, and then hopefully be the part of the organization that interfaces directly and gets information back to patients in this bi-directional mode I was speaking about. They correctly or now have been enabled by information and by their ability to have their voice heard. I would encourage them to go down that path. I think it's very important that they be independent organizations. They need to be that in order to be credible to us and to be credible to regulators and to payers and to other patients, frankly. I think that they are doing this, and I'd encourage them to continue getting the information that they need. So we need, it's complicated, we need to hear from them the patient stories and what really bothers them, but we also need them to be looking at this complex process and the way we're all kind of integrated in a network and figuring out where they can be most effective jumping in. So we all have to get educated in this new world.